As part of efforts to address the emigration of medical professionals, President Bola Tinubu has approved the National Policy on Health Workforce Migration. The Coordinating Minister of Health and Social Welfare, Prof Muhammad Pate, disclosed this on his X handle on Monday. He said the policy is more than just a response to the ongoing exodus of healthcare professionals, but a comprehensive strategy to manage, harness, and reverse health worker migration. In his words, the policy is more than just a response to ongoing exodus of healthcare professionals. It is a comprehensive strategy to manage, harness, and reverse health worker migration. It envisions a thriving workforce that is well supported, adequately rewarded, and optimally utilized to meet the healthcare needs of all Nigerians. End of quote. Many Nigerian healthcare workers leave the country for greener pastures, leaving their colleagues to contend with additional workload and extended call hours. Now, joining me on the program this evening to discuss this is Tuyi. Mebawondu is a public health consultant. He joins virtually from Lagos. Thank you for joining in, Dr. Tuyi.
Yeah, thank you, Mr. Adegbooye, for having me. Thank you so much.
All right. Let me first start with what you think of this new initiative, the National Policy on Health Workforce Migration. What's your take on the initiative itself?
Yeah, for us, it's encouraging. It's every step that is taken to reverse the negative health indices of Nigeria is worth applauding. Of course, you agree with me that the negative indices mostly arose from the fact that we have massive shortage of health workforce in Nigeria. And now, of course, you know that the best statistic we've gotten from the number of doctors who has renewed their registration in Nigeria this in last year was just 55,000. That's the maximum. So if you have 55,000 catering for the health of 200 million people, you know that is not an appropriate figure. And you also agree with me that we had as much as 15,000 doctors leaving the country in the past 5 years. By the data we've seen that, okay, many of them, every country actually take the Nigerian doctors now, you know, from Canada to Europe to USA, even as far as like Scandinavia and UAE. So it's important that we honestly look at a thing that can keep the workforce in the country to deliver all that is necessary. But it's heartwarming that we see that we're now looking at strategies to manage, to harness and reverse the health workforce migration out of the country. First and foremost, we see that government is talking about working condition of the doctors. We want the working condition to be better. We want to pay them good salaries. We want them to have an environment, a work environment that is good. You want to use technology to advance the working condition, like electronic medical records. Okay, you want to actually build investment and you want to twin, or what you call the exchange, you know, whereby, you know, a doctor that goes outside Nigeria, you know, the other country will have to also send another doctor to Nigeria. Well, if you look at the details of those things, a lot of them have challenges because, number one, you have to rely on both federal government and state government to manage these things. If you are talking of doctors, health workforce, you know that you have a long way to go in that regard. You have a long way to go.
All right. I mean, we would of course dwell on the content of this particular policy, particularly the exchange that you talked about, the one-for-one. But let's, you know, give some sort of context to some of the issues that, you know, have allowed or that have necessitated this migration. On talking about statistics, for instance, the Lagos State Commissioner for Health, that's Professor Abayomi, reviewed a significant shortfall in the state's medical workforce. According to him, he said Lagos State is currently deficient of approximately 30,000 medical doctors necessary to meet the healthcare demands of the state. Also, the Deputy Registrar of the Medical and Dental Council of Nigeria, Dr. Victor Kolawole, revealed that only 58,000 of the 130,000 registered doctors in the country renewed their annual practice license in the year 2023. And you also said in your opening remark that about 55,000 doctors are currently in the country catering for over 200 million Nigerians. What are the current, or can you just please itemize some of the current challenges an average health worker faces in the country at the moment?
Yeah, again, you have problems generalized to the country. You have problems specific to the health profession. Now, if you look at the generalized conditions to the country, of course, you and I will know about the challenge of security. We know about the challenge of even infrastructures. You need light. You remember the other time, a lot of hospitals were talking about what they were paying to ensure that they have power in their health system. And you talk about equipment. These are critical factors, generally, mitigating of those. And then doctors or health workers, remuneration is a big issue there. The work environment is bad. The remuneration is poor. They cannot access proper training that to make them stand out anywhere in the world. So these are the factors. And then if you add that to the general condition of the country, you then see reason why anybody will seek a better condition of service outside the shore of Nigeria. So these are some of the factors, like we used to say, we have the pull and the push factors. But look at it, that we're just having capacity to train just 3,000 doctors. That's the capacity to train. In this whole of the country, we can only train 3,000 doctors. What is the shortfall? We have as much as 360,000 shortfall of doctors. Lagos State is having 30,000 shortfall of doctors, right? If you look at the total number of doctors in Lagos, maybe about 7,800 or thereabouts. Abuja is next. That's about 4,000 or about 4,500 doctors. About half of that is now.
All right.
The rest of Nigerians are just having maybe 2 doctors for 10,000 people. So you see that in reality, we have capacity to train 3,000. We have a shortage of 360-something thousand doctors.
Now, I'm going to...
Where is the just to train them? Where is it just to train them? So for me, if we really need to address the challenge of human resources for health, it's first of all to create that our HRH observatory, human resources for health observatory for the nation, and then we're able to increase the capacity to train medical professionals. We have to increase the capacity. We have massive shortage of that as well as.
Is it? I'm sorry to of course interrupt you. Is it just? I mean, you keep talking about the capacity to train more, but again, I mean, we have Nigerians, medical professionals scattered across the world. Many of them having their first training here before, getting some sort of advanced training in the countries that they choose to reside in. Is it about the training now? Because I know that many of these schools produce doctors yearly, or the remuneration, the payment package. Because I'm looking at the chart right now. Countries that pay the highest for doctors and, of course, medical-related professionals. You have the likes of Switzerland, Canada, Luxembourg, the United States, Ireland, Australia, Austria, and Belgium. And, of course, I mean, you look at all of this, opportunities are there. Nigerians looking for that kind of opportunity, they move. So I would like you to speak more on the remuneration aspect. For instance, an average, resident doctor, how much do they earn compared to what those outside the country earn? Is it competitive?
Now, how can it be competitive? Indeed. The best you can earn as a consultant is maybe 800,000 naira. And if you do that to dollars, you know what that means. It's just, you're just doing like $300 or thereabouts.
That's as a consultant?
Yes, as even a senior consultant. You're just doing that. So, and then if you look at the inflation of everything in the country, you then understand where you are with those kind of money. And why wouldn't anybody want to earn better money to make his life better, create an environment for his children to grow, and then even himself to have some peace of mind, have access to researches, and even the best of materials to practice his work. One of the most painful things for a doctor is to see him looking at his patient dying when he knows that he can, if he has this and that, he can do more. So that is key issues. You know, if you want to talk about remuneration, Nigeria is not just there. We shouldn't even go like that. Let me also tell you that the issue of doctors' migration is worldwide. It's not just Nigeria. You know, India could cope because they are producing sufficient number of doctors. That's why they can afford to send some and still keep the many at home. You'll be surprised that even as today, many of those doctors that you've trained, you're having in the country, that number, a lot of them are not actually having job. You know, it has to be you looking for connection or who you know to even give them job. Because number one, even that amount of money, that paltry amount of money we're talking about, the capacity of a lot of states to pay is compromised. They cannot pay. They cannot pay. So rather, they will not want to hire doctors in that regard, to the number they want. Then secondly, you want to send them to rural area to do what? Where there's no light, where there's no infrastructure, where there's no water supply, where there's even the hospital there's no ambulance support for that hospital. How do you run this kind of thing? So our health system is quite challenged, and I see this initiative, well, wonderful, but I can see a lot of challenges.
Okay.
in
Maybe we should explore some of those challenges.
For health program.
Let's explore some of the challenges you might anticipate, you know, with this particular initiative. Would you like to itemize some of them, please? Dr. Tuyi, can you hear me?
I can hear you. Can you hear me very well?
Yes, I can. I said, please, would you like to go through some of the challenges you might anticipate with this initiative?
Okay, hold on. Okay, now, before you actually try to craft the initiative, you need to answer a big question on security around the country, okay? Not just around the country, even security in health facilities itself. You need to address that. Secondly, you need to address the issue of equipment. If you see our capacity to manufacture any of those equipment, they are compromised. They are seriously compromised. Even drugs that are supposed to be available, they are compromised. And then you need to address the challenge of doctors before you now the numbers. Before you now start saying that, okay, human resources for health, I want to really see how to reverse the migration. What numbers are you actually producing? Okay, so you need to address those three critical issues, because now you want some type of drug, you are not getting it. It's going to be frustration. Okay, then you also need to address the capacity of finance. States may not be able to pay even this increased salaries you are considering for your doctor. If you need, Lagos State said you need 30,000 doctors. Do you know the meaning of paying 30,000 doctors in a state like Lagos? Now, if you go to, let's say Sanfara needs maybe 10,000 additional doctors, where would they get money to pay for those doctors? So now, is it such that federal government is now going to take over the payment of doctors' salaries and remuneration? I know that through some of the funding, they can help improve the condition of the primary healthcare centers, condition of secondary health centers, and some tertiary hospitals. But in reality, what of the remuneration? What of the other items that feed into the proper healthcare system? So if you say government to do all these things, it's not just federal government alone employing doctors. The states are also employing doctors. And then are stay ready to follow federal government in this regard. Now, when you look at that exchange program they're talking about, one-to-one exchange program, now you have to really have an agreement with such a country, because the country also needs those doctors. The country, and then you cannot then, ride on the human rights of some doctors in a foreign country because you want to fulfill your own. So there are a lot of,
but there are also concerns. I'm sorry, Dr. Tuyi.
Trying to train as many doctors as we can train. Secondly, we also have to.
All right, Dr. Tuyi. There are also concerns that this policy will sort of restrict doctors, Nigerian doctors, who intend to leave the country for greener pastures. I mean, is there credence to that from your knowledge of this policy?
You create crisis. You cannot restrain doctors from leaving the country. You cannot do that. It will receive a lot of backlash because in reality, you have to then restrict IT people from leaving the country. You have to restrict other professionals, engineers and everything from leaving the country. Why would you want to target doctors if you are not going to really make life especially interesting for them to stay in the country? So I don't see anybody restricting anybody because in reality, you see doctors being trained, paying as much as 2 million, 6 million, depending on the university, to train every year, 6 million to train. So government is not paying for those things. Government is not adding anything. Now they're talking about tuition fees in government-owned hospitals, government-owned universities only. Are you extending that to private university? If I so train my son or my daughter as a doctor, with my hard-earned money, why would you want to restrict him to stay in your country? People will bring legal issues around, human rights around it, and it's going to be difficult to implement. It's not going to be a proper way to ensure that we retain our doctors.
All right. You said something about the workforce, the country working to shore up the number of trained, professionals to meet up with the population. I would like you to, of course, shed more light on that. We have medical schools, and we also have even universities that churn out doctors and medical professionals yearly. Is it about the numbers or the profitable and full utilization of these numbers?
Let me. Now, let me take you through the process. Do you understand what I'm talking about? The first thing is this: if you want to train medical workers or health workers, it starts from secondary school. Okay. The funding system says that in this training, you must have enough students, school students that are offering science. Okay? You must have enough secondary students that are offering science, and then they'll be able to enter universities. Our capacity, to even train science students in secondary school is compromised. Most people want to do the other type of, which of course they are all those are necessary, other type of courses, commercial business and all those art courses. Okay, but now you have to actually increase and incentivize training of science students in secondary school. After you might have done that, then you move to the capacity of the universities or tertiary institutions to train health doctors or health workers. Let me give doctors an example. The whole of Nigeria, all the medical schools in Nigeria, both private and public, the capacity is just about 3,000 medical doctors every year. 3,000. Okay? Now look at Lagos State that kind of need as much as 30,000 doctors. What it means is that if we are taking all the doctors trained every year in Nigeria, we are putting them in Lagos State, it's going to take 10 years for us to get to their number. So that is not possible. So now you cannot imagine our shortage of 360-something thousand doctors. That's the shortage. It means that you are going to use how many years? Close to 50 years or more than that to train, okay, to get to that number. So it's a lot of issues, but I see their incentive, but it's good to try. But maybe as we go along, we'll start addressing some of those core challenges that will arise from there. But I would say, if you don't address the general issues in the country, the general issues that has to do with security, that has to do with the funding of the hospitals and even the health workers and the payment, if you don't address the disparity or of treatment in different states, where a state will say that I only have capacity to hire 20 doctors, so that says
okay,
hire 30.
All right.
If you don't address those things, and you don't address the issue of equipment and training, as I said, you will run into trouble trying to get that to implement that your national human resources for health program.
All right. I mean, because you're pressed for time, let me just ask you before I let you go. There's also the issue of medical tourism, particularly on the part of public office holders. Many are of the opinion that, initiatives like this are brilliant. However, commitment is usually the issue. And many have suggested that, commitment, particularly from decision makers, would happen when it's in law that they use public health facilities too. Do you think that that would rub off in any way in ensuring that, initiatives, particularly to show up and also improve the healthcare sector, would help? Addressing issue of medical tourism, particularly on the part of public office holders and politicians.
Thank you. I've raised this issue on your program, one of the programs in the past. Those people demarketing our healthcare are actually the politicians, okay? Now, if you want to actually allow doctors to stay here, allow the politicians to also stay here and take that treatment, okay? We deserve our politicians also deserve our doctors. So don't let anybody run away. Let's face our issue by ourselves. So as long as a politician can leave this country and go abroad to take treatment, okay, then there's a conflict of interest. Why should you be able to go out and not go out? Let's go and meet there. So we need to address the fact that if you are a public office holder, take your treatment in Nigeria. I don't want to even start mentioning education. If you're a public office holder, take your treatment in Nigeria. Let's address that. So if you don't address that, if you want doctors to stay and you still have to run to India and run to Germany, run to UK, run to US for your treatment as a big boy, then it's not worth it. There's no reason you should stop any doctor from staying, or anybody at all from staying. So as they are doing that, let us legislate that all our doctors, our politicians ought to stay in Nigeria and get the treatment from our hospital, either public or private. Now, you see what we've seen in America is what we call the growth of health industrial complex, whereby you see health becoming a big industry, whatever it takes, there's a lot of investment, there's a lot of, yes, government is doing research, there's a lot of investment, big investment into procedures, into research, into policy, into knowledge to drive healthcare we desire. I have not seen that kind of investment. I have not seen that kind of research. I have not seen that kind of input that will leverage. I have not seen that kind of cooperation that will allow mega hospitals to spring up that can drive, that can really do a lot of work.
All right. I understand that.
That investment that can manufacture drugs and up-to-date equipment for us. Now we're moving to the era of AI, artificial intelligence.
I understand that we need to go on a break. Thank you so much.
We're moving to the era of artificial intelligence in health. That's a lot of money. That's a lot of money. We'll see how it goes.
All right, Dr. Tuyi. Dr. Tuyi, thank you so much. I understand that we really need to go on a commercial break. Thank you so much for your time on the program. That's Tuyi. Mebawondu is a public health consultant. He joined, of course, virtually from Lagos.